And this is Vanessa saying, okay, we're spotlighted. Okay, so we're having more families joining us now, so we're very happy to see them. And if everyone can please turn off their cameras and mute themselves as they join. Okay, hello everyone. Thank you for joining us this evening. My name is Dr. Natalie Delgado, and I am the statewide outreach director for deaf education at the Louisiana School for the Deaf. And we oversee the networking outreach for families, professionals in the school system in Louisiana. So we are very excited to have all of you here with us tonight, joining in on this virtual workshop with Vanessa Magnon. So she will be presenting, and we also have some events for families of deaf and hard of hearing students. So if you're having any issues tonight, any technical problems, anything pops up during the presentation, please feel free to contact me through the chat, and I will be here throughout the meeting. If you have any questions for Vanessa during the presentation, if you could go ahead and type them in the chat, and she'll respond to them at the very end of the presentation. Okay, alrighty then. And are there any questions for me before we get started? Okay, and I will turn it over to Vanessa then. Thank you so much for coming tonight. All right, hello everyone. My name is Vanessa Magnon. This is my sign name. And I'm so excited to be here with you all again. So last month we did the first presentation. It was the part 1. So if you haven't seen that, you're welcome to go ahead and view that on the LSD YouTube page. It should be there, and you can view that workshop. So we went into a lot in that presentation, and they have several different videos on their website. So tonight we're going to focus on deafness, more so cultural and not necessarily a medical diagnosis. So I did already introduce myself in the previous presentation, so I'm not going to go into depth tonight. So I work for the Louisiana Commission for the Deaf, doing outreach and training. I'm the coordinator for those two different things. So what I'm doing tonight is, kind of gives you an idea for what I do in my job. So before I get into the presentation, I'm a deaf person. As you can see, I have a sign language interpreter here speaking for me as I sign. And I saw some of you who just joined. You have deaf children, I believe. So I'm really thrilled to see all your parents here. These are the objectives for tonight. I would like to talk about these topics that are, basically geared towards families who have deaf children. So you really want to be able to expose everyone so they can become aware of what it's like to, have a deaf person in the family, basically exposing them to the language and the culture of deaf people, because it's vast and it's very important to expose them to that. So I'm not going to talk too much about a medical diagnosis of deafness. I will briefly touch on it, but I'm more so going to talk about the cultural implications. So I'm going to talk about it when a deaf child is born, they will experience several different barriers, and we want to talk about how to remove those barriers. If you watch the video from last month, you can see an introduction to that. And I do really want to make sure to encourage all of you to keep that in mind, how important it is to provide access for deaf, blind, and hard of hearing children so they can have equal opportunities to hearing children. So today, by the time we finish this session, you will all be able to see this information, that you'll be able to share, that it's not a stereotype that we want to really continue having. We want to kind of remove that stereotype and talk about what the stereotype is, what the identity is of a deaf person. And we're going to talk about how you can see and learn. You know, tonight's part 2, like I mentioned before, and you'll be able to become more aware of what to expect and how to expose your child to other deaf people. And also you will become an advocate. So I'd really like to emphasize the importance of giving children equal opportunities. It's so incredibly important. All right, so tonight we're going to talk about these 4 different items. You can go ahead and read that yourself. All right, so here are some terms that I would like to share with you. It's really important to know different terms regarding identity. So you will see different terms along your child's journey. And when people see the word deaf, they'll think that means one thing only. But to be honest with you, there's so many more meanings to the word deaf that relate to identity. So you all as hearing people, you know, you are people who are able to hear. We as deaf individuals, we call you hearing. That is our label for you as a hearing person. So hearing people don't say, hey, I'm hearing. And other people say, yes, I'm hearing too. We don't have to announce that to each other. So let me show you an example. So right here, a hearing person who has average hearing and speaking capabilities. So for example, when I see a group of hearing people, I see that they're hearing. So last month I was talking about Earth, you know, people who are able to use their vision, and then also Earth, which emphasizes the ear, but then to have a separate word that uses the eye, a more visual world, you know, because there is a majority that is hearing culture. But then if we had an IF, like I spoke about at the last session, it is a world where we emphasize deaf people being able to be visual and not have to rely on auditory information. So when deaf people see the hearing world, we call them hearing. So you also see the word oral here. What this means is a person who could be deaf or hard of hearing, and they don't prefer to use sign language. They use speech only. So this is a person who's become skilled at speaking clearly. And I mean, it really depends on the person, depends on their hearing level as to their speech, depending on how they were raised, whether they were trained to speak and listen. And it also just depends on the individual. So, you know, this is what we would call small d deaf. And when I'm going to talk about that, there's a big D deaf and a small d deaf. So right here, this kind of goes into it. And it's really important that you know the difference between capital D deaf and small d deaf. So small d basically means a person who is not involved in the deaf community. This is someone who is not involved in deaf culture, who does not use sign language, or perhaps doesn't depend on it. Maybe they sign in English structure, maybe they use cued speech, perhaps they're mainstreamed in a public school with other hearing students. And they're more so involved in the hearing community. Now, capital D deaf is the opposite of that. Very, very different. It's a group of deaf people who are very proud of their deaf culture, who use American Sign Language, and who are completely immersed in the deaf community and deaf culture. And there are a variety of deaf people within deaf culture, but they are all very proud of their deaf identity. So capital D deaf are people who, you know, they don't want to be fixed. They're happy the way they are right now. Whereas typically with a lowercase d, those are people who want to become similar to hearing people. They want to regain that hearing. There's nothing wrong with either. You know, people who are happy to be special the way that they are, that's really what we want to support. You know, it definitely depends on how children were raised. So for example, personally, I was a small d deaf. And my parents didn't know what to do with me when I was born. I was two before they finally found out I was deaf. I didn't go to a doctor. I had no medical diagnosis until I was 7, which is very late to be diagnosed as deaf. So I had no early intervention. I had no type of support. And my parents really were clueless as to how to deal with me. And so finally, I was able to understand my identity when I went to the deaf school at age 13. that was in Baton Rouge. And it was really culture shock for me. I got to see sign language used for the first time. And within a month, probably 2 months of immersion, I was able to pick it up. So prior to that, starting sign language little bit by little bit, I started using signing as the exact English, a little bit of speech therapy and trying to read lips. And then at age 13, I learned American Sign Language. So talking about ASL, which worked for me, and signing exact English did not. So it's really English word order, and it didn't really match for me. So, having all those years of language deprivation was really challenging. So it's a good thing that I was very motivated and I was able to be immersed in the deaf school. And I had wonderful teachers there and deaf role models, et cetera, that were very helpful for me and for my development.
And my mom helped me to stay in touch with people and continue with that learning process. At age 27, I finally accepted my own identity. And that was a little late. And when you teach a baby, if you can teach a baby who they are from the time they're a baby, their own identity, as opposed to me when I was 27, and having my own identity. If you can do that with a baby and not have any questions when they don't have any questions about their identity, that's great. So hard of hearing often can switch back and forth between the hearing world and the deaf world. They can choose one or both. And there's a third group. Hard of hearing could become latent deaf. Some people who became deaf later in life are hard of hearing. So it really depends on where they were raised. If a family who is already deaf happens to have a hard of hearing child, then the hard of hearing child can learn visually ASL from their parents and be considered capital D deaf. Now remember, there's deaf, deaf-blind, lowercase d deaf. Those people can choose to be capital D deaf. At the age of 27, I consider myself capital D deaf from that time on. But up until that time, I would say I was a lowercase d deaf. But since the age of 27, I've been completely involved in the deaf community. Hard of hearing people have a privilege where they can join in the deaf world or the hearing world. Some hard of hearing would rather not say I'm hard of hearing. Some people identify as being deaf. It really depends on the individual. Deaf-blind, it really depends on the vision that they have. Some people have a tunnel vision. Some people have tunnel vision in one eye. Some people have lowered peripheral vision. Some wear prescription glasses in order to see better. So there's a varying degree of blindness with deaf-blind individuals. They can also be capital D deaf, culturally deaf, or lowercase d. And you see here, it's spelled deaf-blind. So you can see how it is to be written. Helen Keller, National Center, says that it's an appropriate way to use that word, deaf-blind, as how you would be able to identify a person. At the federal level, they still make two words with a dash in between, deaf-blind, but the Helen Keller National Center has changed it to deaf-blind being one word. And it's the same with the federal level. They still use the term hearing impaired. But here in Louisiana, in 2017, a law was passed that the proper terminology is deaf, deaf-blind, and hard of hearing, not hearing impaired. Now, some people that are not culturally deaf, the lowercase d deaf, are okay with being called hearing impaired. But the deaf community as a whole would prefer to be called hard of hearing. So it's really about respecting people and how they want to be identified. So when you meet someone and you look at their signing and whether or not they are proud to be deaf, that's how you would know if somebody is capital D deaf or culturally deaf, or as opposed to someone who maybe doesn't use a lot of sign language, replies on oral communication, or sign exact English. That might help you to be able to see how someone identifies, whether they're culturally deaf or not. And we respect people however they identify. So there's a video here that we can watch showing that not all deaf people are the same. Okay, there's no volume on. Hold on one second.
Deafness is a spectrum. It's not just one definition. Someone like myself who's late deafened.
I am deaf in one ear and hearing in the other. Some people view me as a deaf person, some view me as hearing, but it's not one or the other.
I was born deaf. My father is deaf in one ear, so it's hereditary.
I'm the youngest of 5 siblings. The 3 youngest are deafblind.
I switch between deaf and disabled because I'm also a little person.
Being deaf is a big part of who I am, but that's not my only identity. I'm a person of color, biracial, half black and half white, and gay.
This is the condition I have. It's called Usher syndrome. It's a hearing and vision loss.
I grew up oral.
A lot of people consider me hard of hearing.
People do call me hearing impaired, but I'm not. I'm deaf.
People think being deaf is a bad thing, but I see it as a positive thing. The culture, language, and history make me who I am today.
The deafblind community, tactile ASL, the use of space, the culture, all became a part of me.
I'm learning little by little about Protactor, and I can't wait to learn more. I am most comfortable with speaking English.
People with additional disabilities have to think about access and what they want. Do they know what they need?
Throughout educational years, I used note takers. I didn't have interpreters because I didn't know sign language. I didn't know ASL until I was 14.
I used cued speech and was mainstreamed throughout high school.
I went to a public school in the morning, then a deaf school in the afternoon. It was the best of both worlds. The instructors used ASL, which I found to be more inclusive.
I was in both deaf and hearing classes. I wore that bilateral hearing aid cinched across my chest. Very unpleasant.
I got a cochlear implant when I was 15 and went through intensive speech therapy. In high school, I would sit to the far right, since I could hear on my left side.
In large group discussions where there's dynamic conversation, I use interpreters.
In my own experience, captioning and interpreting together are the most effective.
I want more of a long-term designated interpreter. Someone who knows me well, who knows my work.
As a Black person, I want my interpreter's voice to match me. My culture can't be overlooked.
People automatically think deaf people are all the same, but that's not true. We have layers upon layers.
When you meet us, have an open mind and open heart.
So that gives you a sense of how varied deaf people can be. And there's different identities. You don't want to make assumptions about someone's identity or how they identify. I remember when I was first learning all of this, I was at the School for the Deaf when I was 13 years old, and I really didn't know my own identity for such a long time. So they called me like hearing on the brain because I was so much involved in the hearing world. I used total communication or sign exact English. And then I had to learn how to fit in the deaf world. It takes time to adapt. And then in time, I wanted to be like the deaf community. I was proud to be one of them and comfortable. I'm so comfortable where I am right now. I'm happy with the way I am, who I am, and there's nothing wrong with me. So that's where it makes me feel good. The hearing world, I don't feel comfortable there, but I do in the deaf world. We have some myth busters here, something that you can keep in mind. So 3 words, all, always, or never. For an example, all deaf people are the same. That's not true. That's just an example of those 3 words that you want to keep in mind not to use. When you hear from people saying, talking about stereotypes, and that information isn't right, you can tell them what you learned from deaf sensitivity training, that what they're saying isn't correct. You'll be able to do that. So here's a myth that all deaf children use American Sign Language. The fact is that yes, many people do use American Sign Language, but there are other modes of communication, such as signed exact English or cued speech, total communication where you're signing and talking at the same time. But there's a lot of those who do use ASL, that is true. But if you're looking at somebody from a medical perspective who is deaf but not exposed to deaf culture, typically they use signed exact English or cued speech. That's the small d deaf, the medical model where people want to be fixed or want to be like hearing people. The next myth is that all deaf children are mute and very quiet. Guess what? We do have noisy voices, yes. A lot of people can say yes, no, or cheer, or yes, that's right. When we're mad, we make noise. When we're excited, we make noise. When we're scared, we make noise. So we're not always mute, no. We can make verbal noises. For an example, on my presentation, I don't want to use my voice today because if I try to use my voice without an interpreter, you may not understand me. My speech is not that clear. I don't say every word correctly. It's better to have an interpreter do the voicing for me in order to facilitate communication. I could mislead you if I voice for myself. It's easier to do it this way. The next myth is all deaf children benefit from hearing aids and cochlear implants. You see the 2 pictures at the bottom. The picture on the left, there's different kinds of hearing aids. Some of them are older, some of them are newer. And for hearing aids, you don't need surgeries. They just go in your ear canal and help to amplify sounds. Whereas the other picture on the right, that would require a surgical procedure where a device is inserted and wires, implants, or put in the cochlea. And that helps noise to be conducted into the ear. So many children who are deaf can benefit from hearing aids or cochlear implants, but it is not effective for some. And if it's not effective, then they won't use it.
And they might be able to only hear things like a car horn, or if somebody calls their name or says, "Hello, Vanessa," you know, that might get my attention. So it's somewhat minimal. It's not 100% access to communication, to spoken and listening language. It's not. And it also doesn't work for everyone. I don't think everyone's aware of that. It does require a lot of training once the child is implanted, so they know where the sounds are coming from and to distinguish what they are. And there are some students, children or babies, who have never gone to any type of training after being implanted, and they don't know what the sound is that they're hearing. So that's very challenging. And it really can lead to issues. If they do go to training, they are a little bit more able to recognize the sounds. Parents have to be involved and make sure that they are training. It's the same as speech therapy. So those that are culturally deaf don't really have to worry about depending on their hearing or their sound. Instead, they can just enjoy being around other deaf folks. You know, we don't rely on speech or hearing. We can just use visual language. But if you are involved in hearing culture, it will require that you rely on your hearing and listening. So people don't realize that, but it doesn't work 100%. Some people it does, and some it does not. So deafness is genetic. 100% of people who are deaf, it's genetic for them. Are deaf people all going to have deaf children? No. So typically, deafness can be passed from one deaf family member to their children. It is possible for that to happen. However, 90%, and I think actually the statistic has gone up to 95%, it's a very high percentage of deaf children have hearing parents. So for example, in my family, my parents are both hearing, I'm deaf, and then my daughter is hearing. So there's no other deaf in my family, and that's very common. All deaf people can read lips. Is that true? Well, some people are quite expert at reading lips. That is true. There are some individuals that are able to, you know, so people who are hired for the FBI or the CIA, and they can watch people from across a room, and they can read their lips from far away, maybe across the street, or anything like that. So there are people who are very skilled at reading lips, and they can tell, you know, the other employees what they said. Not everyone, though. Not everyone can read lips like that. So for me personally, if a person's sitting across from me, I have to ask them to go very slow. I have to ask them to repeat what they said, and I may only get 2 or 3 words, and then I'll say, "Can you say it again? Can you say it again?" And so I might catch on to more and more words as they go along, but that takes a very long time. So the reason that it takes a long time is letters like E and P look exactly the same on the lips. X and S are another example of letters that look exactly the same. So for example, the word beach, peach, and then the bad word, you know, the B word, they all look the same. And so I don't want to say the wrong word. You know, I have friends who say, so for example, my sister would make fun of me and she'd say, "Ha ha ha, you just said a bad word." I say, "No, I want to go to the beach. I want to go to the beach." But on my mouth, it looks the same. So from then on, I kept my mouth closed because I didn't want people to think I was saying the wrong word. So lip reading it's very challenging, and it made me feel kind of sad, like I couldn't speak clearly. So I kind of gave up on it. And I said, honestly, I would rather just, you know, use sign language and not try to use speech. So that's my individual story. Okay, so I'm going to challenge you all now. We're going to watch this, and put yourself in my shoes as if you were a deaf person. So this is going to be a lip reading challenge for you all. Are you ready?
Hello and welcome to Charlie's lip reading test. So are you a lip reading expert or novice? This test is designed to help you find out. It's simple. All you have to do is read my lips and work out what I'm saying. I'll say each statement twice without making so much as a sound, and then I'll tell you the right and sometimes also the wrong answer. So are you ready to get started on the first statement? Let's turn the volume down. Did you get it? Okay, it's a bit of an easy start. If you thought I said, "Hi, my name is Charlie," then you got the right answer. If you didn't get it, then you might be about to find the rest of the test almost impossible, but try and hang in there. Okay, time for the second statement. Volume down, please. How's that one? It's a bit of a trick question. If you thought I was saying, "What would you like to read?" then I'm really sorry, but you were wrong. I was actually saying, "What would you like to drink?" Now, drink and read look pretty similar, don't they? But it's important to get them right. Otherwise, you could end up ordering a pint down at the library and a book in the pub. Okay, now it's time for the next one. If you read the article, you might find it a bit easier. Volume down again, please. If you thought I was declaring my undying love for you, well, I'm sorry, but I'm already taken, and I've got 2 kids, so I'm quite a long way down that road. Now, I wasn't saying "I love you," but I was saying the much more random phrase, "elephant's shoes." Do elephants even wear shoes? I've got no idea, but the 2 phrases look almost exactly the same. So now you know why I blushed when 2 girls said that to me without sound at the back of my English class at school. I'm still getting over it. Okay, let's move on. We're now entering the pro zone. Things are about to get a lot tougher. Let's turn the volume down for the 4th time. Did you get it? The sentence was, "I feed my tortoise tomatoes and lettuce." Did you get tortoise, or did you think it might be daughter? That might sound strange, but the 2 words are homophone. They sound very different, but they look almost identical to a lip reader. Okay, now it's time for the final test. Now this one's very difficult, so just do your best. I'm not expecting anyone to get it, and if you do, you should probably go to the World Championships of Lip Reading or something. Let's turn the volume down for the final time. So how's that one? Any luck? Professional deaf people might have got it. The phrase was, "The euro was introduced in 1999. Deaf lip readers often say that numbers and dates are very difficult because of the similarities between how certain numbers look. For example, 8, 9 and 10 look very similar, and so do 7 and 11. And then there's the problem of differentiating between 19 and 90, and don't even get me started on million and billion.
Okay, so I was planning on asking you all which one surprised you with that, with the lip reading challenge? But hold that thought for now. So I wanted to talk about stereotypes. The ones that we just discussed, I'm not going to talk about anymore. So you can clarify that to other people when they say stereotypes to you. You can say, no, that's not true of the deaf community. Now you all have more of a clear idea. You know, they expect us to be able to lip read perfectly, which is just not accurate. Hearing people often have no idea how hard it is for us to lip read. It's really difficult. I've taken 11 years of speech therapy, and I went to my classes twice a week from elementary school on to high school. I went to speech therapy for several years, and I kind of had enough. So there's some hearing people who know that I'm able to understand them. They speak very clearly and I can understand good enough is what I'll say. But it's really hard work. And sometimes you feel like it's a challenge for you to understand what was being said in that video. That's how I feel all the time when I try to lip read. So all this information that you've learned today, you know, something that, you know, this is a deaf sensitivity training that we do at colleges where there are deaf students. And there's some students who have become deaf later in life, and they may call themselves hearing impaired, which is fine, that's their prerogative. And the student asked me, do you drive? And I said, yes, I drive, I have a car. I arrived here in my car, I drove myself. And they said, oh, I didn't know you could drive. And I said, you're deaf too, right? And she says, oh, well, I'm hearing impaired. And I said, well, you're hearing impaired, but you drive. And she said, yes. And I said, we're exactly the same. So that was one very interesting experience that I had to clarify that for that student. And now all of you have learned something that you can keep in mind for the next time you interact out in the community. You're able to educate people as well for us. So please spread the word. And I used this quote last month as well. I'd really like to emphasize it. You know, this is a very famous quote. This is from a deaf actress, Marlee Matlin, and I just wanted to share this all with you. This is very powerful. You know, knowledge is powerful. Reading and writing, they're incredibly helpful for deaf children to be able to thrive. And other things, you know, such as cued speech, cochlear implants, all of those are fine. Those are all tools. But the most important thing is communication, is to be able to read and write. And that's how children will be able to be successful in this world. So this is the quote I was talking about. This is the well-known deaf actress, Marlee Matlin. And this quote is one of my favorites. And she says, I hope I inspire people who hear, because hearing people have the ability to remove barriers that prevent deaf people from achieving their dreams. So you all have that ability as hearing people. We have barriers, and for your children, you're able to remove those for them in the future. So I'm hoping that you'll be able to do that and help us do that. And Louisiana Commission for the Deaf, here's all the contact information. If you want to reach out to us about anything, you can contact us there. And feel free to follow us on the Facebook page. And we also have a website if you want to check that out. All right, so I'm curious if you could tell me now what surprised you with the lip reading challenge. I'm curious what your thoughts were. You can feel free to type them in the chat if you'd like. Hello, everyone. This is Dr. Delgado speaking. Thank you for the wonderful presentation, Vanessa. I really enjoyed everything that you had to share. And I did want to make a few comments. The videos were a little bit choppy, so I am going to share the links for those videos to you, and you'll be able to watch it on your own later if you'd like to watch them again and make sure that they're clear. This is Vanessa speaking, no problem. And I'm curious if any of you had any questions about identity. Yeah, and feel free to ask me. If there's anything you'd like to know about me, I'm happy to answer. It seems we have a quiet group. Are there any questions at all for me? It doesn't matter. You know, don't feel like this is a stupid question or I don't want to ask, I'm going to hurt her feelings. This is your opportunity, so feel free. You know, your children might ask you these questions later on, so you can be ready to answer them. So Dr. Delgado and I are very happy to answer your questions if you have any. And this is Dr. Delgado speaking. As you think about them, you may not have any questions yet at this time. Feel free to take some time and then email Vanessa as well. You can email us if you are unsure of what you want to say now or if your question pops up later. And Vanessa, would you mind pulling up the website again and posting the links to the videos? And while Vanessa's pulling up the links for the videos, I just wanted to quickly share our next workshop with you all. It's going to be April, I believe, April 25th, but let me double check. Yes, it'll be 6 to 7 p.m. And that workshop is going to be focusing on using AAC for deaf and hard of hearing children. And that'll be a presentation by a speech language pathologist who signs and is very experienced with AAC. And so if you're not familiar with AAC, that is alternative augmentative communication, and basically using different pictures, communication devices, and things like tablets and things like that to aid in communication. Okay, and Vanessa just shared the different links for the videos in the chat for you all to view later. Feel free to go back and watch them again later. And I believe someone just asked about a book related to inclusion with deaf children in the chat. So you're looking for a book that has a deaf character, is that what you're asking for? And I'm not sure who posted that in the chat. I'd like them to expand a little bit on exactly what they're looking for.
If you're looking for a list of media, like TV shows or movies or books, apps, different things with deaf representation or different kinds of deaf people being involved in the media, we do have a list on our website, and I just put that list in the chat as well. All right, well, if there's no other questions, then we appreciate all of you. Hope you have a wonderful evening, and we hope to see you next workshop on the 25th of April. And Vanessa said, thank you for having me. Bye.